Glad everyone's here. Glad Laura Gusé is joining us today. She is certified, LSVT Big certified, and received her master's degree in physical therapy from the University of North Dakota. She has over 15 years of experience working with adults with neurological disorders with a special focus on Parkinson's disease and multiple sclerosis. She's been certified in LSVT Big since 2009. She's an LSVT Big faculty member and clinical expert and has helped to develop many of the current LSVT Big treatment tools and videos, webinars, and curriculum. She now serves as the Chief Clinical Officer of LSVT Big, and we're so grateful she's joining us today. Thank you, Laura.
All right, thank you for having me, Eden. It's a pleasure to be with you all, and I hope that you enjoyed today's webinar. All right, are we ready for me to share my screen? Sounds like yes. Okay, just give me 1 minute here. Okay, and all right, and Kelly or Eden, if you can just give me a thumbs up that you can see my screen. I got the thumbs up. Great, good. Well, the title of our webinar today is Pursuing Productive Partnerships in PD Relationships. So just a little bit of alliteration fun on a Friday. But honestly, I'm really glad to bring you this topic as a therapist who has worked with couples and different types of caregiving partnerships over many years. They've taught me a lot of things, and I'm just really eager to share some insights and some tips to help you make your partnership more productive as well. I won't read my bio because Eden already did a nice job of doing that, but just know that I do work for LSVT Global, and after this webinar, if there's any desire to reach out to me, I'll have some information at the end with our webinar, our website and our email address. So I just thought it might be nice to start our webinar today with a story. I was telling Eden and Kelly that creating this webinar just really pulled out a lot of warm and wonderful memories, some challenging memories of caregiver partnerships over the years as patients came to see me to receive physical therapy. And I want to tell you about one that has really just meant a lot to me over the years. I've thought about it time and time again. And just so you know, their names are not Don and Jean, and this is a representative picture of them, not actually them, but I just wanted to give you a visual image so you wouldn't be staring at a blank screen as I tell you about them. So their story is definitely real. I can't remember how many years I saw them, but Don had advanced Parkinson's disease when he came to see me for a physical therapy evaluation. And I remember when they rolled in and his wife, Jean, was pushing him in his wheelchair. I found out that they'd been married for over 50 years, and she really now was his primary care partner. So to me, he looked quite frail. He was a thin man. You could tell that he had advanced Parkinson's disease. And throughout the interview, really, he did very little talking. He had very little facial expression. Jean kind of told the story about his Parkinson's and his symptoms and what brought him to therapy during that one evaluation. So I also felt like they were struggling at home. You know, she had her own health issues. It was becoming more difficult to help him with day-to-day activities, even getting in out of bed, using the toilet, getting up from chairs, dressing, etc. So she was doing all of this, but had her own health issues, plus doing all of the normal activities of the house, you know, cooking and cleaning, driving him to a great many doctor's appointments, therapy appointments, and stuff. And so she was tired. She was tired physically. She was tired emotionally. She wasn't, you know, really angry about it. She was just plain tired. And to me, Don seemed a little bit depressed. So they came to therapy hoping that Dawn would become more independent physically so that her physical burden of care as a caregiver would be less. But because of their amazing partnership, they received a lot more. And that's really what I want to tell you about. So went on to see Don for LSVT Big. So actually saw him for 16 more hours of therapy that month. So with LSVT Big, they're seen for 1 hour sessions, 4 days a week for 4 weeks. So during that time, I really got to know Don and Jean quite well. At the beginning, I honestly wasn't sure what I could expect, how much improvement he could make physically, but they were willing, and I felt like they deserved a chance. So we did therapy. And what was really neat was that every week that he came to therapy, he opened up more, he started talking more, he started becoming more expressive, even though we weren't working on speech therapy. Just he started, I started understanding more of who he was and more about their relationship. And one of the things that he just loved talking about was his wife and how long they'd been married, and just how very much he appreciated her and how special that she was to her. And he said that when they were first, before they were married, he used to write love letters to her, and she loved those, and she had kept those over the years. But because of his Parkinson's, his writing had become very small, and he just had really given up on trying to write anything anymore because it was not legible, and it was frustrating for him. And so I just thought, man, if I could help him learn how to write again, so he could write something, maybe that would be meaningful for him. So that was part of what he worked on every day as part of his homework. I was determined to help him, and he was willing to try and work on it as well. So I'll fast forward to the end, so that we don't take this whole webinar on his story. But 4 weeks later, they totally amazed me. Jean had come to therapy with him almost every session. She learned how to do the exercises so that she could do them along with him. And on the side, she said they were really good for her as well. And she learned how to cue him, how to help him so that it wasn't so much of a physical burden for him to walk to the bathroom or, walk around the house, get out of bed, get dressed, all that stuff. So by the end of therapy, yeah, he was able to walk with a walker. He was in a wheelchair all the time, and he made all these like amazing physical gains with his mobility and with his ADLs. So his final homework assignment was to go home and think big while he was writing. So we really worked on making his letters bigger and sustaining them so they didn't trail off. So his final assignment was to write something that was at least 2 paragraphs long, and he had to keep it big so that when he brought it back to me the next day, I would be able to easily read the whole thing. So he came back in the last session, and you could tell he was kind of excited. And I asked him about his homework assignment, and he pulled out this piece of paper, and he decided that he wanted to read it. So he didn't just hand it to me. He says, "No, I want to read it to you." And I think you probably can guess what it was. It was a letter to his wife. And in this letter, he expressed how much he appreciated her, he loved her. And by the end of the letter, I kid you not, we were all crying. Like I was crying, she was crying, he was crying. And it was a really, really beautiful moment. And I think because it's so emotional, that's why I remember it to this day. So I learned a good lesson with Don and Jean. As a therapist, like we're trained to help people restore their function, improve their function, and sometimes just maintain their function is a good thing too. Like that's always upmost in our mind as the measure of success. But what I didn't really realize until then was that as a result of that improved function, I think the greater outcome that they achieved was some of that relationship was restored. Their primary relationship their whole life was as husband and wife. And now they had some of that back again. And their care partner relationship was able to take a bit of a back seat where it should be. And that's really what I want to share with you today is, just some of that hope that we can work together to improve function and improve movement and improve voice. But the ultimate goal is to, improve that care partner relationship for both people, the person receiving the care and the person providing the care as well. So hopefully you enjoyed that story. I guess my question to you is, what are you pursuing? And when you go to a doctor's appointment or a therapy appointment, there's always a reason, right? Or there's always something you hope to gain in the back of your mind. And, think about the last time that you went to therapy or you went to a doctor's appointment. What was it? What was it for you? For some people, they're, initially looking at, is there a cure on the horizon? Maybe I want to be able to improve my symptoms that are bothering me, or I want to like slow down the train. I don't want this disease to progress. What can I do? Sometimes it's just information or education, so you know more about it and can kind of plan what those next steps are for you. For the caregiver, the questions and concerns might be different. You will have questions about like, what does this mean for me as a care partner? Will I still be able to work? What happens to all the plans that we had for the future? Will we still be able to do those? How will this impact our relationship? How am I going to manage everything if my loved one can't do what they used to be able to do? And so there's just a lot of questions. These are just examples. And sometimes it's just one day at a time, but you both want hope for the future and you want to live a good quality of life. And really, that's what it's all about when you partner together as a team. So, under the surface, when people come to therapy, we also understand that there's a lot more that we can't see initially, but we know it's there. And for caregivers, there might be, fatigue or burnout. They might be, grieving loss of present function or future hopes and dreams. They might be dealing with, feeling lonely or worried or anxious or sometimes even angry. I've seen that too. And those are really valid feelings to feel when you're dealing with something big. There's some caregivers that don't really understand the non-motor symptoms of Parkinson's. We'll talk about those in this webinar today. And some people just don't have the personality that is naturally a caregiver. They don't naturally fill those shoes. They have to learn how to be a good caregiver. And it's hard to switch identities from being a spouse or a child into a caregiver role. And then a lot of people come to therapy and see me and, they probably didn't have the best relationship even before Parkinson's disease, and adding the stress of that can strain that relationship. The same for the person with Parkinson's. They can come really tired, not just from the disease itself, but just tired of going to appointments and, just kind of feeling burned out. A lot of people don't want to be a burden on others. They too are grieving the, potential loss of things that they want to do in the future are not certain about it. Like, I still want to do that. Will I be able to do it later? They might be struggling with non-motor symptoms like apathy, depression, anxiety. Those are very common in Parkinson's disease. They might be struggling to communicate feelings, and maybe because their facial expressions aren't as expressive as they used to be, people are misperceiving it as you being sad or, depressed or not wanting to be involved, when it's not really the truth at all. And then same thing, you too might be dealing with some long-standing relationship issues as well. So we as therapists know all this underlying, but it takes time for that to come out and for us to really understand like how we can support both people in the relationship to be able to just live a better life despite having a diagnosis like Parkinson's disease. And the examples that I'm going to give you in this webinar are really related to LSVT Loud and LSVT Big, because that's what I know best. That's what I've done for so many years. But I think a lot of what you learn today and hear today are very easily generalized to really any therapy or any treatment that you might receiving. If you're not familiar with what LSVT is, a lot of people know, what does it stand for? It stands for Lee Silverman Voice Treatment, because it was named after a woman named Lee Silverman who had Parkinson's disease and inspired it. LSVT Loud is the speech therapy, and LSVT Big is the physical and occupational therapy. Both of them are standardized protocols. You heard me mention that there's a special dosage. We see patients for 4 days a week for 4 weeks. They're 1 hour, one-on-one individualized sessions. And the reason for this is it's based on over 30 years of scientific research. And so time and time again, through all sorts of randomized control trials and other studies, we know that for these treatments, this is really effective. Like these treatments work to improve a person's voice and their mobility and their function. During the sessions, people that receive LSVT really work hard, but we support you. And it is a treatment that's delivered only by clinicians who are certified in this treatment. So what's unique about it if you haven't received it, but have had other therapy and you're wondering, oh, what's different about that? One of them is that our target is what's called amplitude. So we know that Parkinson's tends to make movement smaller than normal, and it tends over time to make the voice softer than normal. And so we counteract that by training a louder voice and bigger movements, but not to the point where a person is shouting, not to the point where a person is moving in some exaggerated way. We're really just moving the bar up to that normal zone again, where it should be if you didn't have Parkinson's disease. The second way is in that it's not just exercises that work on movement and motor symptoms of Parkinson's disease, but it also integrates treatment of the non-motor symptoms of Parkinson's disease. And we'll talk about that a little bit later. It's individualized one-on-one training, so it's not group exercise. It's not like going to a gym and taking an exercise class, even a Parkinson's exercise class. It's very, very tailored to each person, and it's very one-on-one for each person. So even though it's standardized, we really take a lot of time to talk about with you, like, what is it that you want to get out of this? So in that example I gave you earlier, the gentleman really wanted to work on handwriting. He also wanted to be more independent with basic things like getting out of a chair, walking, getting out of bed. But for some people, it's like, I want to be able to go on vacation, and I need to be able to get in and out of my vehicle, maneuver through the airport, down the airplane, on all sorts of terrain, and we focus on that. It could be speech goals, like I have grandkids and I want to be able to FaceTime and have them hear me, or I want to be in a restaurant where there's a lot of background noise and people aren't always asking me, can you repeat yourselves? And so we really try to dig in and find out what is it that you want to work on, because in therapy, we don't do just exercises, we really work on functional tasks that are specific to you. So we train those things. And then we can adapt it or progress it for a number of different people. People that are newly diagnosed that you really can't even tell they have Parkinson's disease, to people that have really advanced Parkinson's disease with very more severe symptoms. Now with LSVT Loud and LSVT Big, our goal is that by the end of that really intensive 1 month of treatment, you can use your louder voice and bigger movements more automatically, and it'll just continue to carry over long term. It's not one of those treatments that you're done with treatment and then everything goes back to the way it was before. If you continue on with your daily homework, 15 minutes a day, it really does last over time. The role of the family and spouse is this. Our operating principle in LSVT Big and LSVT Loud is always empower the client first. You are the one receiving the care. We want you to be empowered and take charge, because if you're the one that takes the responsibility for yourself and your own health, you're also the one that gets to reap the reward, right? It could be improved self-confidence, your quality of life, your self-efficacy. Like, I'm not doing this for anyone else, I'm doing this for me. And that's a really, really good feeling at the end. But we recognize that sometimes the family or care partners are necessary because of physical or cognitive changes, and sometimes the family is desirable. Sometimes caregivers or family, it doesn't have to be family, can really, really be a motivating factor for the person receiving therapy. So let's talk about how can caregivers our care partners help during and after LSVT Loud and LSVT Big. I'm going to show you a couple of really short video clips that were taken from a prior webinar that we did. And this is an interview that one of my colleagues was doing with Gary, who has Parkinson's disease, and his wife, Joan. And Gary had received LSVT Loud speech treatment, and his wife, Joan, is commenting also on just some tips for other people as caregivers. So listen to this quick little video. It's about 2.5 minutes long.
I suppose like the biggest thing for me is, I suppose, reiterating what I just said, you know, or what I said earlier, that get involved, be involved from the get-go, you know, try to, you know, absolutely go along to all appointments, you know, try educate yourself, as well as, you know, you were educating yourself, but it's important for partners to educate themselves, just to understand the journey, understand what people are going through, understand how difficult it is to do those exercises all of the time. If possible, I think talk to your speech and language therapist about the possibility of sitting in on some of those sessions, just because I think people can feel, well, I wouldn't know if I was doing it right. Like, am I helping him? Am I hindering? Am I doing it the right way? People might be afraid if they are speaking too loud, you know, it's going to hurt my voice. So to get involved, but also then I think to be part of that negotiation, to, you know, have that conversation around, well, how do you want me to help you? Do you want me to, are days you want me to stand back because I know I can badger? But there can be like, is it, you know, how do you want me to cue you? You know, what is it that you'd like me to do? Because it is hard to get that balance between, you know, not being overly involved, but equally not, you know, supporting enough. So I think you need to figure that out between you, rather than maybe one person deciding this is what should happen.
Great. Yeah, that's great words of wisdom. Thank you, Joan. And then, Gary, did you have anything to add there?
I'd just like to add that I feel so fortunate that I'm with Joan, and she's my care partner and partner for life. And I've been really, you know, in the context of a really devastating diagnosis, I'm at a point now in my life where I'm probably, ironically, I mean, I'm in pretty good shape physically. I know what to do if my voice is fading and stuff like that. I can do exercises and I can recalibrate myself and get myself up. And that's great. So what I would say is, just don't beat yourself up if you don't do your exercises 7 days a week. It's kind of, you know, that you're going to hit a point where you just, because of its very nature, Parkinson's kind of seeps into everything. So your motivation is going to be hit some days, and that's okay. It's not as if you've fallen down the ladder and you're kind of wasted, and it's no good because you haven't kind of done exercise consecutively or whatever. Just take it easy on yourself, but do the exercises as often as you can, and understand that every time you do the exercises, you're adding to your life. You're giving Parkinson's the pushback, and you're in control, not Parkinson's. And I think we can all do that.
Wow. Well, thank you, Gary. Thanks for sharing that. I think that's a really powerful message for everyone in the audience to hear there.
All right. I love hearing Gary because he's so empowered, and he always inspires me, and inspires others too. This next
But I
video,
think the main thing that
on
the
just
therapist
1
told
second.
us, that I said to Terry, we're going to.
All right, this next video here is an interview with a caregiver named Deborah, and she is the cousin of a woman named Terry. And Deborah is a full-time care partner for Terry. And same thing as in the last video, these are just a few pearls of wisdom that Terry is sharing on being a care partner. Excuse me, Deborah's sharing.
I think the main thing that the therapist told us, that I said to Terry, we're going to do it, and that's why she had success, is you have to commit to the time, especially when you're doing the program, and even after. You have to make it part of your daily life. So you pick it. And then to be encouraging, because Terry doesn't see that she's not big. She really has more of a, you know, she doesn't see it. So they also gave me a tip, and they would do it, and I do it, is we videotape her, and then we show her the video. And that helps Terry register that, oh, I'm not moving very big. So that was another helpful tip.
Oh, that's great. So you kind of have touched on it, because everything you're sharing is really words of wisdom, but do you have any specific words of wisdom for either care partners or individuals with Parkinson's who are in the audience, kind of how they can work as a team during the treatments?
Yeah, definitely. You know, I've always been a good listener, but to try to understand, you know, and listen to Terry and see what, try to connect it with what she enjoys. I think one of the things with her voice that I did is I got this clipboard and I put her exercises on it for the voice. And I said, Terry, you're already having, breakfast, lunch, dinner, pick a meal and do it after that. So I had her connect it. So it's not always like, oh, I'm enjoying a meal. Maybe I get on a Zoom call with church and then, oh, I have to go do this. And so I've tried to make it part of like, something she's already doing. I make it fun by getting her a voice remote for her TV and make her shout out what she wants to watch next. I have her join book clubs that are remote now, but I really try to push Terry to stay involved. Stay on the finance and the parish council committees. Don't quit life because you have Parkinson's. You can still do it. You might take longer to get there, but you can get there and you have a lot to offer. So it's that kind of positive thing because she feels like she can't do the things she could do before Parkinson's, but you can still do things. So
That's great. Yeah. So it really sounds like you're helping to empower her. Yeah.
Exactly.
All right.
Oh, sorry. I didn't mean, I think I keep cutting you off. Go ahead and finish your thought.
No, I was saying about we're saying about being social. The other thing I do for her voice is every week we write down 2 of her friends. She has a beautiful group of friends, lifelong friends from first grade. And Terry's in her 70s, God bless her. And I have her call 2 people a week. I write down the names, she gets on speakerphone and she stays connected to her friends because some of them live in, all over. And I use that as a voice. And then they notice, they said, what is she doing? Because she's so much easier to talk to. She's clear, she enunciates. So the speech therapy was excellent. And Terry has a better relationship with all of her friends since the diagnosis. And then she feels better about herself and she feels really engaged with life. So
that's great.
That's what I sort of focus on is things she enjoys. And we're going to travel again. She thought travel was over. She's a big traveler, but we're going to get there. So.
Oh, that's so great to hear.
All right. I love that video too. And one of the things I love the most about what Deborah said about Terry was she has so much to offer. And I know that we could say that about every single individual. Every person has so much to offer. And certainly we don't want Parkinson's to change that at all or hamper that. And so that's one of the just wonderful things that can come out of a successful care partner relationship is to make sure that that person is still engaged in life and offering everything that they should be offering to others. All right, so a few tips from LSVT clinicians, and each of these slides is kind of a different theme. So first of all, be positive. That is so, so important. I know as a married person myself who's been married for 23 years, it's kind of easy to, get a little irritated with your spouse sometimes and, be negative about things. But with Parkinson's, really, really important to stay positive. And so as much as you can, try to focus on those moments when the person gets it right and not wrong. And so if they're intensively working on their voice and you can hear them, for that moment of time, say, wow, I could hear you that time. That was great. Your voice sounded so strong then. Or maybe they've been working hard in therapy on their walking and walking with bigger steps. And you notice that, hey, you're successful. Like, wow, you're walking right next to me. You're not walking behind me. Those little moments of positive encouragement mean a lot to someone who's working really, really hard on those things during therapy. To notice that somebody else is noticing is really, really wonderful. They need to hear that. And then help facilitate positive interactions beyond yourself. Deborah did such a good job of giving examples of this in her video, but think about, are there ways you could help to set up Zoom calls or phone calls or, get-togethers so that the person working on their voice can have a chance to really practice it and get comfortable using that louder voice around others. And hopefully they'll get some positive feedback from other people as well. That really helps to calibrate them what we say and to make that treatment so it's a lasting treatment and doesn't just disappear after treatment is over. Being empowering, also very important. So step back, let them try something first before you jump in to help or do it yourself. You may be used to jumping in and just doing it because it's faster or easier, But remember, the goal of the therapy is to take you a little bit out of the picture as a care partner and have them do more. So you might have to kind of retrain your own behavior with that as well. You might also think about, are there roles that the person with Parkinson's maybe stopped doing after Parkinson's disease that they're actually, capable of, that they could resume? Are there things as simple as like cleaning off the countertops, or, answering phone calls, writing notes, helping with simple household chores. It may take a little bit longer than you can do it, but it's really, really important to keep people engaged and productive and contributing as well. So stop doing everything for them. Therapists will tell you that a lot. People with Parkinson's are very, very capable, and we're working hard in therapy on helping them to become more independent and, help improve their self-efficacy. But that requires a partnership from you too, to again, kind of retrain yourself and what you're doing. So learn how to be a good coach. It might be necessary that you come to a therapy session or multiple therapy sessions so you can really understand what they're learning, learn how to do the exercises if you're going to be coaching them at home. During the end of the 4 weeks, it might even be good if you can ask to lead a session to make sure that you're being a good coach, that you're doing it right, that you're modeling the exercises correctly, that you're giving the right amount of cueing, because after 4 weeks, that therapist is out of the picture and you want to really feel confident that you know how to help carry on at home. In the middle of the month, you might just touch base with the therapist and say, hey, here's how it's really going at home. And hopefully that's a good positive thing. And be patient. I know for me, that's one of the hardest things in any relationship, is to be patient. But new habits, they take time and they take a lot of practice and, positive feedback, positive reinforcement. Some communication tips. We also want to set people up for success. So the goal is to retrain healthier, louder voice, but we can also work on the environment as well. So when you're talking to someone, try to talk face to face so you can see each other. You'll be more likely to understand each other that way. If you can, turn down the background noise when you're trying to have a conversation. And then if you can sit in quieter environments, like if you're in a restaurant, that is also helpful as well. Some movement tips. Come to therapy, learn how to cue someone. Oftentimes the therapist's greatest fault is using way too lengthy of explanations. And that can be the same thing for a care partner too. We give these really long, verbose explanations on how to do something, but it could be as simple as use a big lean to get out of the chair, or remember to take your big steps as you walk down the hallway. Something very, very simple, but learn what the right things to say are. You can provide cues to move big during challenging tasks. Maybe the person with Parkinson's really struggles getting that second arm into the coat sleeve. And in addition to being, patient, you also want to cue them properly and say, remember, use a bigger push, you can use it. If they're having difficulty, you can also pause and ask them, how could you do that bigger? Or do you think you can do that bigger and with more effort? When you're in public and you don't want to use, verbal cues like that, it could be simple nonverbal cues, like maybe just a hand on the back to remind them of their big posture, or a simple, hand gesture to remind them to think big when they're moving. So understanding a little about Parkinson's is really important as well. And hopefully all of you that are listening today know that it's not just a motor disorder, but that it's a non-motor disorder as well. And I think that as we really understand the complexity of Parkinson's disease, it helps us to have a lot more empathy for what that person is going through. The common motor symptoms. In LSVT big and LSVT loud, we really focus on hypokinesia, which is small, underscaled movement. It affects movement of the limbs and the hands, but it affects the voice as well. So the voice can not only be quieter, but it can become more monotone. It results in smaller movements like, reduced arm swing, the steps are smaller, like little fine motor tasks like opening pill bottles or buttoning buttons or handwriting can become much smaller. And that tends to become more severe as the disease progresses. For the person living with Parkinson's, if you're someone joining us, you know that it takes a lot of effort to just override that tendency to move small or to talk softer just to get up to that normal level again. And so there's also a range of non-motor symptoms in Parkinson's disease. Depression is much more common in people with Parkinson's disease than in their peers of the same age. There can be changes in thinking. There can be problems with internal cueing, like remembering to move bigger, remembering to use a louder voice. Just processing takes longer, learning takes longer, but the person can still learn. There's sensory changes that we'll talk about, and there can also be emotional changes like apathy, like just not really wanting to do or being interested to do the things that they used to do, or anxiety about things. And those can really impact a person almost more than the motor symptoms in many cases. So with this sensory disorder, there is a scaled down output. The person with Parkinson's thinks that they're moving quite normally or speaking loud enough, but in fact it's not. So if you see, if you're a care partner and you see your person with Parkinson's leaning or maybe, with a flex posture, they might not really perceive that at all until you show them on a picture or video. Oftentimes they think that they're not walking too small, but that maybe everyone else is walking a little bit too fast. Same thing, very often the person with Parkinson's denies that they have a problem with their voice, but really thinks that everyone else has a problem with their hearing. This is just a sensory deficit that's very, very common, but we have to recognize it so that we can overcome it, because when we ask a person to move bigger in therapy, oftentimes it feels weird, it feels too big. And if we ask them to talk louder so it's a normal level, sometimes it feels internally like they're shouting. So it takes a lot of repetition and reinforcement and just positive feedback, not just from the therapist, but from the care partners as well, just to reassure them that, hey, this sounds great, or you look amazing. You don't look like you're, moving in a weird way, and I can hear you. It doesn't sound like you're shouting at all. So let's talk just a little bit about cued versus internally versus externally cued movements. With Parkinson's disease, there's a disruption in the internal cue. So that's why a lot of patients don't self-initiate, use of bigger movement or a louder voice. But we know that it's unique in that if we tell a person with Parkinson's to shout, they can shout. If we tell them to walk in this exaggerated manner, they can do that. So they can respond to external cues. So it's important to really learn about these non-motor symptoms and really dive in and ask questions about them. Like, do you have any changes in your thinking or memory? Do you have any problem with multitasking, dual tasking? Any problems with your mood, anxiety, sadness, apathy, depression? Because those are common, and we want to recognize that and, work with you on that. But for the care partner, it's really, really important to know that these are common and that it shouldn't be misinterpreted as, not wanting to do something, that they're not trying, or that they're just being lazy. No, it's not that at all. It's just that, hey, maybe I'm really struggling with apathy, or I've got some depression going on, or I'm really anxious about, doing that activity that you're asking me to do. And so those just should be recognized for what they are. So it's not easy. Learn about the sensory deficits, experience what it feels like to talk too loud and move too big, like have a conversation with someone and shout. How does it feel? It feels just strange to you, right? And so recognize that that feels like that oftentimes to the person with Parkinson's as well. So you can have some empathy with that. So that's kind of some tips for during treatment. Homework with LSVT is really important. The same can be said when you're going through any treatment regimen, whether it's, therapy or really anything. Like, do your homework, not just during the month, but really lifelong as well to maintain. And, you know, Gary and I think Deborah both alluded to that. In LSVT, we have specific homework support tools to, you know, help people that are going through the program and their caregivers, such as videos. There's a software program called the Coach. We got some newer graduate classes for people who have gone through the programs called Loud for Life and Big for Life. And we really embrace a dental model of care where people come back for a tune-up just to check out how they're doing, maybe have a few refresher visits on average every 3 to 12 months. And then we try to like actually look in the community and see what exercise is available to you and get you hooked up if that's something that you'd be willing to do as well. In terms of homework, caregivers can help by helping to establish a routine, like figure out what the best time of day is, where you're going to do it. Might need help with setup, like, hey, go get the chair, put the DVD in, start the video, help them with the coach. Remind them. Sometimes it's just a reminder, hey, it's 10 o'clock, time to do your exercises. And then check in, you know, don't just, you know, check out, but check in. How did it go with your exercises? Did you write on your homework log? You know, give any feedback to the therapist about how it's going at home, and then learn how to cue or coach, as we said before. So really the goal in therapy is to start working on forming the habit of homework on day one, so that by the time that month of therapy is done, you're really solid in that habit. It's not a new thing that you need to develop on your own. Like I said, LSVT has postgraduate groups, and the goal of these is to help people have continued positive social interactions, stay motivated to keep going with their home exercise programs, and really just improve adherence overall to the recommended tune-up schedule. Keep moving big, keep talking loud, and they're super, super fun. There could be LSVT Loud for Life and Big for Life exercise classes in your community. There could be some online as well. And LSVT Global has a new virtual live exercise classes called LSVT for Life. And those are administered through a site, through Zoom. And if you're interested in that, our website is lsvtforlife.com. If you're looking for an LSVT certified clinician in your area, I won't go through all of this, but there's a search tool on our website where you can type in where you are, the distance, your location, and find out who's certified in your area. And you can also find out if they deliver Loud for Life and Big for Life. Just a few questions to ask. We always want people to make sure they get the actual treatment of LSVT if they come and, you know, receive therapy. So the gold standard is always 4 days a week for 4 weeks, 1 hour sessions. If it's less than that, or if they say they do it, but, you know, don't do that dosage, you're really not getting LSVT Loud or LSVT Big. So we always want people to get the best outcomes that they could expect as if they were, you know, from the research studies. So ask about that. I won't go through these. We've just listed some links, and you'll be receiving a handout on different websites you can go to. Of course, the PMD Alliance is so amazing in all of the information and education and support tools that they provide to people with Parkinson's and movement disorders, as well as caregivers and family members. So thank you for everything that you do. If you want to learn more about LSVT Loud and LSVT Big, there's just a wealth of information. You could spend days scouring through our blog and website, but those are there. And I'll just leave these summary points up in the slides for you as well. But my own personal summary is I just really feel like, gosh, there's just so much goodness that can come out of a successful care partner relationship. And I really hope that you sense that your therapists are on board with you, and they're going to do everything that they can do to enhance this and improve the quality of life for both of you long term. So I want to leave a few minutes for any questions that have come in, but I'll leave our website up here and our email address. We're a relatively small company based out of Tucson, Arizona. So if you're ever in Tucson, stop by and say hi. But if you email info@LSVT Global, with really any question related to LSVT loud or LSVT big. They will be sure to direct it to the right person and get you the answers that you want. All right, so I think I stayed in my 45 minutes.
You did great. This was excellent. One question we have, does Medicare cover LSVT? And then I do know that the scripts tend to need to be very specific so that it leaves, can you talk about that a little bit?
Yeah, absolutely. So Medicare doesn't cover any therapy by its name. So what Medicare covers is physical therapy, speech therapy, or occupational therapy. Then it's really a decision up to the therapist and up to you as a person living with Parkinson's of what treatment option to pursue. So when an LSVT big or LSVT loud therapist evaluates you, if they think that you're a good candidate for LSVT, at the end of the conversation, at the end of the evaluation, they should present you with the treatment options, and then you can decide, yeah, this is something that I want to do. If you do it and go forth, well, the therapist uses just normal billing codes that are covered by Medicare. So Medicare does not have a dollar cap or a therapy visit cap. It's really based just on medical necessity. Once you get to a certain threshold, the therapist has to just apply a specific modifier to the billing codes to continue to have the therapy covered. So in our experience, we haven't had any issues at all, knock on wood, for Medicare Part B. If you have a private insurance or on a HMO where you might have a visit limit, your therapist will identify that, and sometimes what they can do is pre-authorize the entire 16 session protocol so that you can receive it.
Somebody asked about would tiny little habits would that help? Just improving little things.
Oh yes, like small motor things, fine motor things. Absolutely. And those can be super frustrating, right? So things like, buttoning your shirt, zipping your zipper, brushing your teeth, putting on makeup, putting on earrings, handwriting, opening a bottle cap, all of those things can be impacted by Parkinson's disease. So our core focus with LSVT big is big, right? That's the word. And so if we say to someone, with Parkinson's disease, watch me open a bottle, the person with Parkinson's disease may make these little movements and it may take like 10 little twists to get it open. And the therapist will say, okay, watch me do it. And they'll say, big twist. Let's see if we can get it down to like 2 or 3 twists. And they can, right? They see that, wow, that actually works. And we practice that over and over and over again until it becomes a habit for you. But that principle can be applied to almost anything.
And is there someone specific you might say would be a good candidate for LSVT? What kind of issues would that person have if you were kind of like, oh, this person would be a great candidate, but oh, I don't know about this person?
Yeah, that's such a great question. Through research and through clinical practice, we found that people with idiopathic Parkinson's disease are almost, I would say 99% of the time, good candidates because they have these core underlying symptoms of hypokinesia, which is small movement, and bradykinesia, along with non-motor symptoms. And classically, those respond very, very well to LSVT big and LSVT loud. But what the therapist does during the evaluation session is something called stimulatability testing. It's a big word. It took me 10 years to learn how to say it properly. But the question they're trying to answer is, can you be stimulated to move bigger or talk louder? So if I walk down the hall in this, bigger than normal way and turn to you and say, can you do that? Can you mimic what I just did? Even if it feels crazy, even if it looks crazy, no one else is watching, let's see if you can do it. If that person has the capability to move bigger when I cue them to, it's a very good prognostic indicator. The same thing with LSVT loud. We do some testing and the therapist will say, we'll demonstrate how to use a louder voice. They may go, I want you to do this. Ah, really loud. Okay, now it's your turn. Again, man, I didn't know you had that voice inside of you. So it's a very quick and simple way that we can test. Beyond that, sometimes we do a week trial treatment if we're uncertain. So we schedule it, you know, the whole month, but we say, let's just reassess after the first 4 sessions and then see. And if things are going really great, we'll continue on, we'll finish it out. If for some reason we're not really the right thing, we're not so far into it that we can't pivot to a plan B, whatever that might be. So we have worked with people with early PD, moderate PD, advanced PD, people with dyskinesias, people with DBS, you know, those all have had, you know, positive outcomes. We use LSVT big and LSVT loud all the time for people with atypical Parkinsonisms like MSA, PSP, Lewy body dementia, you know, really there's quite a range of them. And that is more variable, I would say, because of just it's a different disease that we're treating, but oftentimes there's some benefit to be gained. And unfortunately, with a lot of those atypical Parkinsonisms, medication isn't terribly effective. And so therapy, if it can even help a little bit, is a really positive thing.
But does the therapy ever address any non-motor symptoms like the anxiety?
Yes, great question. So I would say not directly, right? So it's not a psychiatric or psychological treatment. However, it has a secondary positive effect on anxiety. I'll give you an example. Let's say that I'm just thinking of some patients I've had. I'm thinking of a patient I had once that had really terrible freezing of gait, and she lived in a large assisted living facility. And every day she had to exit her apartment, walk down the hallway, get in the elevator, and then walk down another long hallway to get to the dining facility. And during that time, she would freeze every single time she went through the doorway, especially the elevator and turning around in the elevator. And then as she walked down the hallway and saw people approaching her, the anxiety of that situation escalated and made her freeze more. And it was really, really problematic for her because she kind of didn't want to leave her apartment. And we worked on it and worked on it, worked on it. And at the end of 4 weeks, we got to the point where she could do it, right? She could, you know, manage all of those things without freezing. And so because of that, her anxiety level was less during that activity. So hopefully that kind of, you know, makes sense how the two things play together.
Definitely. Now, this question is because we do have some people that are flying solo is what we call it, where they either do not have a care partner or their care partner is very active. Because you had kind of talked a lot about help from care partners, and what advice would you give for those who are flying solo as far as like LSVT goes? Because that's actually come up a lot, is that they say, I don't even know that I am talking lower because nobody said anything to me, for example. Or
Right. No, that's great. Well, you don't need a care partner to go through LSVT loud or LSVT big. And chances are you have other people in your life that you interact with, you know, friends, family members, colleagues, you know, people at the grocery store and everything like that. So step one is to train you in what an appropriate normal level of loudness is. We'll talk about speech therapy, okay? So the therapist has a little device called the sound pressure level meter, and they have that, and they can monitor on their screen if you're in that target zone or not. And there's also a software program that you can use so that you can get visual feedback yourself of whether you're in that normal zone, because we don't want you too loud, but we don't want you too low as well. And during that, you know, home exercise program, then you can visually see, as I'm practicing these communication exercises, am I the right target level of loudness? Once you kind of get that nailed in therapy and you're like, okay, I know what that feels like, then you're out in the community and talking with other people when you go to the grocery store and check out. Did anyone ask you to repeat yourself, right? You don't want anyone to say that. Or when you're, in a public situation, are people hearing you? Because you do get some feedback, right, from others if they can't hear you. Are they ignoring me, or am I involved in that conversation? Sometimes when people can't hear you, you kind of get ignored, and that's not a positive thing either.
Can LSVT Big and Loud be provided concurrently with Parkinson's specific PT weightlifting classes?
Sure, I think so. The LSVT Big protocol is a physical or occupational therapy protocol. You could do the LSVT Loud speech therapy protocol in the same month, definitely. So each of those would be 1 hour a day. You'd be doing a lot of therapy, but that's possible, and a lot of people do it. If you want to do something, additional on top of that, I guess there's no contraindication to it. I just wouldn't reduce the dosage of LSVT Big to fit in weightlifting into that 1 hour. They're kind of like two separate things. And then beyond that, I think just like monitor your fatigue level and because you're going to be doing a lot of exercise, especially with LSVT Big. So if that's a concern, I would say, just put a pause on the really intensive weightlifting just for a month until you're done with LSVT Big. But exercise is great.
It's a little bit more of a specific question. This person was diagnosed with PD 3.5 years ago, and 1.5 years ago diagnosed with spinal stenosis. So sometimes she has trouble determining where the pain is coming from.
Yeah. I think
any recommendations, and is this something that LSVT might be able to assist with?
Yes. So really rarely people come to physical or occupational therapy only with Parkinson's disease, right? Because it tends to be a disease that hits people who are middle-aged to older age. We've accumulated other issues over the years. And so a physical therapist has a doctorate degree. They are well-trained in being able to kind of differentiate what's Parkinson's, what's a musculoskeletal disorder. Am I able to make some adaptations so as not to irritate the spinal stenosis at the same time? Maybe it's doing more activities in sitting or taking more, breaks with that, avoiding certain movements so that it won't really aggravate that at all. Sometimes it's a decision of the therapist saying, hey, we really need to treat your back first. And if it hasn't been treated properly, with therapy, and then we'll do LSVT Big. So it's kind of a case-by-case basis, but I would say a physical therapist is well-trained and well-educated to be able to help you make that decision as they evaluate you.
Well, thank you so much, Laura. This has been incredible. I do want to remind everybody, because there were a lot of links put in the chat, although as we did say, this is being recorded. It'll be available next week, and Laura was kind enough to let us share her slides. But if you do want to save your chat, because there were some links, if you go towards the bottom where it's the chat feature, you'll see a little smiley face and 3 dots next to it. If you click on those 3 dots, you can say save my chat, and that will make sure that you keep all the links and everything. Everybody, thanks for joining us today. We do have a tradition here at PMD Alliance, our wave of gratitude. We're so grateful that Laura spent her Friday with us. So thank you, thank you, thank you. And I hope everybody has a wonderful weekend.
Thank you so much. Goodbye.
Bye, everyone. Thank you, Laura.